Hello, everyone. This is Elizabeth Norton from the Disaster Information Management Research Center at the National Library of Medicine. Today, we have a member of our own team who's going to give a presentation, Siobhan Champ-Blackwell, who's a technical information specialist / librarian in our Disaster Information Management Research Center. She's going to introduce the new online continuing education classes related to disaster health information. These have been enhanced and are now on a self-paced type mode, and I think you're going to find these greatly improved. The classes are part of our Disaster Information Specialist program, which is designed to help information professionals, librarians, the disaster workforce, and any volunteers that support them to enhance their skills as maybe an information responder and to learn how to integrate the role of an information specialist into the preparedness and response efforts in your community or even your organization. She's also going to talk about how you can get continuing education credits for these classes, and if you're so inclined, to go for a certificate as a disaster information specialist that is offered by the Medical Library Association. So if Siobhan's ready, I'm going to turn this over to her. All right. Remember, if you want a question, please type that in the chat box.
All right, thanks, Elizabeth. So we are really excited about these classes. Just a little bit about DMRIC, that it is our mission to connect people to quality disaster health information, and we've done this by one aspect of it is this disaster information specialist program that we have. And when we think about who is a disaster information specialist, of course we think about librarians because we are the National Library of Medicine, and we think about all librarians. Public librarians are at the heart of response in their communities, but so are special and medical librarians. And we think of members of the disaster workforce because people in the disaster workforce use information to make decisions in the in the whole cycle, in the preparedness through the response and recovery aspects of any kind of disaster. Information is crucial to planning and responding to events. So one of the things that when we were looking at these, developing these training materials was to make them relevant for members of the disaster workforce and for librarians. And we looked at information competencies. So the Public Health Foundation, they've updated their core competencies in 2014. And if you look through the competencies, you'll see retrieves evidence, analyzes evidence, presents evidence. Evidence is just constantly through those competencies. The National Center for Disaster Medicine and Public Health also has several competencies that include understanding, identifying sources for information, how to share that information in strategic ways. So for the disaster workforce, these core competencies exist. And we've taken all of these classes, we've updated 6 of them recently into this new format. And you can see here that it's a wide range of courses. Well, I'm going to go online and show a few examples of some of these courses and how to access them in a minute. But you can see some of the different topic areas that we cover in these courses. And as Elizabeth said, you can get continuing education. We're going to go back to this, the Medical Library Association survey. We've run into a little bit of a glitch. Of course, when you update things brand new, there's always something that you didn't think about. So one of the things that we are working on is getting this link to the Medical Library Association survey added onto the class itself. I'll show you how you can find it on our website. We're also really excited that our courses, all of these courses are listed in the public Health Foundation Train learning management system, and they're connected with competencies within Train. Elizabeth talked about the Medical Library Association Disaster Information Specialization Certificate Program, but Public Health Foundation Train also has some programs that they've developed, and some of our courses are incorporated into those training plans. So, for example, the Foundations of Public Health Preparedness includes our online class on your digital go bag. So we're really excited to be able to say that these courses, besides, of course, giving you training that we think is relevant, are also are able to give you continuing education and give you tools that you can use in your professional life to demonstrate that you're continually learning and updating in your skill sets. So I'm going to go online, and I'm going to show you the courses and how to access them and get the credits. Also, we're going to have a couple of guest speakers from the National Network of Libraries of Medicine, and they're going to talk about maybe some of the local, you're all scattered around the country, which is very exciting for us, and we're going to try to put you in touch with some examples of what might be going on within your community that are ways for you to get some local help, as well as the resources we provide through NLM. So let's go online here. So what I'm going to do is just start at our homepage. And so all you have to do is know how to get to the Disaster Information Management Research Center homepage. And maybe Jen can put that link into the chat box for you. So we've updated our homepage in the last couple of weeks to make it a little bit simpler to find the information about the specialist program and to make it easier to find the courses. I'm going to start on the Disaster Information Specialist Program and talk just a little bit about that for just a second. So if I just click on that, it brings you into the information about the program. And this program, what we're trying to do is develop a network of people across the country, librarians, members of the disaster workforce, who are all interested in increasing their capacity to respond with information before, during, and after disasters. And we do that by these webinars, and we have a listserv and an online social media. Right now we're on Twitter. But we also then have these training courses. So if you go into the Disaster Information Specialist Program page, you can get to our training pages right there. I'm just going to go back to the home page for a second and show you that also you can access that same link right there. So this page is a joy for all of us now because it's so much simpler to find the courses and access them. On this page, you can learn about the continuing education courses, and this is where you will find, let's see, I can't see it, the survey. Once you're done with the class, you'll have to come back here to take the MLA survey. But you can see we have the basic level and advanced level courses. Anyone can just come on here and take a class. You can fill out the survey, print out a certificate, and you're done, or just take the class and increase your learning. If you're interested and you want to get the Medical Library Association Disaster Information Specialization, it is offered at 2 levels, the basic and the advanced. And so we list here what the basic level requires you to take these 5 courses. Once you've done that, you can take 12 additional hours of any kind of training that's related to disaster health information, including some of the courses listed here, or participating in drills or any kind of activity if you're a member of the Medical Reserve Corps or your community emergency response team, things like that. You can fill out some paperwork through the Medical Library Association, and you can submit all that paperwork to MLA and get your specialization. So I will go ahead and just pull up the MLA webpage just to show you. Let's see. So you would click on this page and it would provide you with very similar information, but here's the information on how to complete the application if you're interested in the specialization. That's a bonus. We're excited to see people get that specialization, but again, we're really putting these courses together for your, to help you enhance your skills. So what I'm going to do right now, I feel like we need a drum roll. We've been leading up to this moment. I'm just going to go ahead and click right here on the basics course. And it right away opens up into the course itself. And so of the 6 courses that we've updated, 5 of them will follow this format. You'll come to an introductory page. On the left-hand side of every page is the table of contents of that page. Up here on the right-hand side is the menu, and so when I look here, I can see that there are 8 modules in the basics course. And so I can navigate through these modules, or I can read through the course, which is what I'm going to do, read through the course. Every page has the learning objectives. The introductory page provides the information on how to get around the course. And what we want everyone please to start by taking the evaluation. The evaluation is very short. It's really just what do you already know. You see how short that is? 5 questions, 5 quick questions. This is really helpful for us to know when someone takes one of these courses, where do they start? And at the end, you'll fill out a post-evaluation. Where did you finish? And so it helps us to evaluate whether or not the course met the objectives that we designed for it, or do we need to make some tweaks on it. So we appreciate that you take the minute or 2 to take that evaluation. And now I can just go here to the next page, and I'm on the course. So there's a couple of things that are built into these courses. As you see along the table of contents here, I've got the topics that are covered by this page, but every page will also end in a key point section. So a summary of what happened on, what did we just talk about? Just a kind of a quick reminder of what we covered on that page. And I'm going to actually go to section 3. I'll show you how to navigate. And on section 3, I thought it was section 3. Maybe I need to section, yes, it is. There's a section called You Try It. And so we've incorporated these interactive scenarios into the courses as well. So, if you've been paying attention, now I come along here and I have a question. If I wanted to find lessons learned documents, where would I go? And I can click on this and, oh no, that's not it. And it actually does tell me, I'll leave this one up a little bit longer. It does tell me the correct answer is both. So if I click on this, yes. And so what we're really excited about these courses because the content is up to date, but it's also this self-paced kind of course where it's more interesting than just than our original format, which in the day that's what we had. We had our webinars that were recorded, but now this content is fresh and new and interesting and interactive. I'm going to go to the conclusion of this course. And you can see, again, we've got some test your knowledge. And these are not, all of this is for your learning. We're not keeping track of this. They're not tests. It's really, if you got something wrong and you might want to review the page. Why did I not get that one right? You can see we've got a lot of additional resources on here, and then we've got the post-course evaluation, which is, you know, again, a few more questions than the pre-test, but again, we really appreciate the fact that you're going to give us feedback on these courses. Now you're done. You've taken this course. If you want to take the MLA CE, you come back here and there's the evaluation link, which is right here, and then I would select disaster information, the basics, and it will pull up the survey for me from the Medical Library Association. And once I'm done with that survey, the certificate for the course will pop up, and I can fill in my name, and I have a copy of the certificate for my personal records and also to send into the Medical Library Association if I decide to go after the specialization. So that's the basics course. The basics course, U.S. response, and information roles are all organized with that same format. There's 2 FEMA courses as well, and if you complete those 5 courses, you can file for the paperwork for this disaster information basic level certification. In the advanced level, we've updated, we've updated a seat at the table and health and disasters, understanding the international context. Again, those are the same kind of self-paced online learning. Now the CBRNE, chemical, biological, radiological, nuclear, and explosives health information resources course is a little bit different because these have 6 modules that are recordings. So are narrated. So when we come to this website, when we click on that course, we come to a web page, and I can start by, I can click the introduction.
Welcome to Health Information Resources for CBRNE. CBRNE stands for Chemical, Biological, Radiological.
Now, I don't think that you can really hear the audio on this. There is closed captioning, and there's a table of contents. So if I want to, so I can click here.
We will start this course by reviewing CBRNE concepts.
And then I can get rid of this. Oh, I forgot here. Get rid of it here. So again, I've got the ability to navigate through even through this kind of video, narrated video, and I can see the captioning. So when I'm done with this module, I've still got this page open, and I can open module 2. When I come to the end, I can go to the table of contents. And I believe that...
Thank you for completing this course. We hope it has helped expand your understanding of CBRNE incidents and how WISER, CHEM, and RIM can help plan for and respond to them.
So right here, when I'm done with this, I've got the link for both the MLA survey and for our post-evaluation. So it's a little bit different. The modules are, again, really interesting. They're probably, I think they're between 3 to 8 minutes long. So you can sit down and do them, you know, one a day, or you can do them all, I think, in about an hour and a half is what it would take you to do the entire module. So we are really excited about all of these courses, and we hope that you find time to start taking some of them and that they're interesting for you. So, Jen, were there any questions that came up while I saw you typing away madly over there, but was there anything that I needed to address?
Yes. Georgia asked if, do we have any shortcut to do the sign-in? She took a class and realized that she had to be signed in to get the credit.
So we have changed everything. Now the way to get the credit is to take the MLA survey. So if you've already taken the course, all you have to do is go to that survey page and click on the course that you took and fill out the survey. We had a they are listed also on a learning management system, and we'll send out the link to that learning management system, and I'm assuming that that's what you did initially, that you logged in to the learning management system. But this is now kind of a shortcut to just save you from one more login.
Jen Packiam, our assistant here, who's also a member of our professional team at the Disaster Information Management Research Center, she's going to put the link in again to the page that has the link to the evaluation survey, which will then take you to your MLA certificate. It's on the training resources page, and if you go there, even if you've already taken it through our prior system, you can click on that page, and I think we're actually going to show that as well.
Right.
You can see where it says evaluation survey, and if you click on that, you'll see that it takes you to the CE survey, and you can click the course that you took, and then go from there, and ultimately you'll get to your certificate as well.
And in fact, this is, if you're on this course and you want 1 hour CE for today, this is the same place you go. So you can see we list the monthly conference calls. So if I click on that and I hit next, then the questions just start coming up, and I get to the MLA CE. So it's pretty simple to do. You just have to remember that you have to start on this page to get to that CE, to the CE survey.
Okay, then another question from Jennifer Johnson. I'm not sure if this will be covered or not, but for the specialist, it mentions the requirements. Participants have 3 years to gather and the contact hours needed to apply for the specialization. Is there a link that provides more information about this? Okay,
so on this page, the specialization is through the Medical Library Association, and so this is how you would, so that's off the training page. You can find out information about the disaster information specialization that the Medical Library Association provides. So it's very similar to looking to our pages. All of these classes are listed and linked just like ours do to the course themselves. If I clicked on this, it's going to take me to that basics course that we just looked at. And then it has the way that you apply. So the most important thing for applying for the specialization is keeping track of those certificates. So once you fill in the certificate, you know, you can save the PDF file to a folder, you can print it out and have it in print form, however is easiest for you to manage the paperwork behind it. And then there's just an application form here from the Medical Library Association that you fill out. For members of the Medical Library Association, it's $55, and for non-members, it's $75. So it's just a process filing paperwork with MLA.
And I think there was if I got that right, there's another follow-up comment from Jennifer. It says that is the page with the comment about the contact hours. So I think that she did, if I'm correct, you went to this page and it says you have a year to gather. And is there more information about that? Am I correct?
I think what that means is that over the course of, you know, when you send in the certificates, you have to have taken, they have to be dated within the course of whatever that time frame is. So if you take a basics course now and 4 years from now you take another course, you can't use the basics course from this year to apply for that application. So it's really talking about the time period that you have to take the courses in, because we want people to stay current. So, which is also why we updated the courses. So we're wanting to make sure that you're taking that you have access to the most recent information and training in order to get this specialization. And if that didn't answer your question, let us know. And also, we can put in an email address at the end in the chat box. You can put in my email if you know it. the longest one. And you can email me.
Okay, anybody, well, this is the end of Siobhan's presentation, and before we move to talk to the National Network of Library of Medicine individuals, I just want to check to see if anybody else has any other questions they would like to put in the chat box. And if you've taken any of the new classes, we'd also like to know what you think of them, and if you think this format is, you know, is user-friendly and maintains your interest. So if anybody has taken those, or if you've taken it in the previous format, we'd love it if you would try one in the new format, and just let us know what you think. One of the original developers of one of the classes, I saw Robin Featherstone, who helped us get started with this whole program, said she thinks the new format looks great, and we are certainly appreciative of all her efforts of beginning this whole. She introduced to us 2 classes, the basics and the information roles. So we took what she did and we had that updated and put into this type of format. So we really want to give her some kudos for starting these classes.
I'm glad you said that, because actually I can't see the list of participants, but I know many of we let the course developers know, and several of them said they were going to be on the call. So John Scott and Pat Bittner.
Right, so I guess that we should be thanking all of the original course developers for taking the time to develop these courses and put together just so much information that's been very critical to us even having this disaster information specialist program. So it was very essential components, and we're extremely grateful for their efforts.
Yeah. Okay.
All right, well, Georgianne said she's taken a class and the format is great, so we'll take that.
Great, thanks.
Comment here.
Thank you.
All right, Siobhan, do you want to?
Yeah, so I'm going to start with Michelle Berta from the National Network of Libraries of Medicine Mid-Atlantic region. For those of you who don't know about the NNLM, just go to nnlm.gov on your website, and you can see a map of the regions to find out which region you would be in. Because what happens with the regional medical libraries is it's like there's 8 little mini National Libraries of Medicine out in the world, and you find out where your regional medical library is, and they have face-to-face training and exhibiting and all kinds of resources for you. So Michelle, we have to unmute Michelle. Somebody else can talk while I'm doing this. Elizabeth? No? You don't have anything to say, Elizabeth?
No, I just encourage everybody to go and check out these training courses, and just also, we're in the process of redoing our entire website, cleaning it up, making it a little more streamlined, a little more contemporary, a lot easier to find things, and that's going to be occurring, I'm going to say over the next 6 months or maybe a little more. It takes a little time to do this, and it should be much easier to find the important information that you might need as a disaster information specialist or someone just looking for disaster health information. So we're excited about doing that, and when we are finished with that, we'll probably bring that up again on another webinar and show people how to navigate around the new site. But redesigning these training courses was the first step in trying to maybe update some of our content and the way that you can get information. So Michelle, are you there?
Yes, I am.
Okay, we can hear you, so go ahead.
Okay. As Siobhan said, I am one of the coordinators. I'm with the Middle Atlantic region, and my official title is Education and Health Literacy Coordinator. So one of the programs we are currently working on is we are in partnership with the Delaware Division of Libraries and the University of Delaware and also the Delaware Disaster Research Center. And what we are doing now, we're planning a one-day long symposium to connect the library staff with emergency planners to help communities bounce back more quickly following a natural or man-made disaster. And the focus of this, we're calling it a summit, the focus is on developing partnerships and strategies before an emergency happens. So also one of the components will be that I will be talking about the National Library of Medicine resources, like Medline Plus, and the focus will be on the health and disaster information resources and also the DMRIC resources. So that's the part that I will be doing. And one of the other things we're going to do is explore what it means for a library to be a second responder in their respective emergency planning and patron communities. Our summit, we hope, will be of interest to emergency planners, first responders, librarians, and organizations involved with disaster planning, response, and recovery. And I thought it might be of interest to you to just tell you a couple of the things we have on the agenda and who those speakers will be. We reached out to Susan Quinn, who she was involved with Superstorm Sandy. She is the Ocean County Librarian and Director of the Ocean County Library, and she is very much involved with the Ocean County Emergency Planners, the Mayor's Office, and the facilities managers in her community. So she will be speaking to the group on some of the things they've done and their involvement during this time. So she will talk about what they've done before to lay the groundwork and then after. And then we're also planning on the afternoon. We'll have a panel discussion in the morning also with our emergency planners, and these will be the county coordinators and emergency responders from the 3 counties in Delaware. And because Delaware is so small, it was an easy group to work with, like I said, because there's only 3 counties. Dan Wilson, who is a specialist in disaster planning for libraries, and you may know of him. He's done many of these type of summits before all around the country. He will kind of be our coordinator and MC for the day, and he'll be conducting the panel. Then in the afternoon, what we hope to do is the people who have come from our libraries and anybody else will be broken up into groups in their respective counties. So we hope that there's a representative from the emergency responders for each county, and then the librarians and these responders will have conversation and time to explore their roles and what the libraries can do. And then this also gives exposure to the emergency responders about what a library can do for them, other than just being a gathering place, what the skills are of the librarians. So that's kind of our day. And again, it's going to be at Dover Downs in Delaware, February 28th. It's not open to the public. This is mostly our librarians, first responders, those type of, and community planners. So that's what the event will be like. And I do invite any of you, if you are close to that Delaware line, or you are willing to travel and maybe this is of a special interest to you and want to see how the event is conducted, and you may be interested in planning something like this in your organization or in your state, we welcome you. There is no cost for registration. So that's all I have. Anybody have any questions for me? I'm happy to answer those, or you can email me at mburda@pitt.edu. Thanks.
Okay, thank you. Jacqueline, do you want to share your screen? We're going to have Jacqueline from the National Network of Libraries of Medicine Greater Midwest region next. Oh, I need to unmute you. Do you want to share it? Okay. Do you want to share the screen?
I put 2 links in the chat window for you if you'd like just to bring those 2 pages up, and I think we'll be fine.
And you want to start with the advisory group first. So
yes, please.
Okay, there you go.
Thank you, Siobhan, and those of you at the Disaster Information Management Resource Center for inviting me today to talk about the initiatives that we have in the Greater Midwest region. As Siobhan said, we are one of 8 regions across the United States who make up the National Network of Libraries of Medicine. My colleague, Michelle, and I have been with the network for a number of years, and with just with this May 1st, we started in a new 5-year grant period. Prior to that, we had a 5-year period where the National Network had an actual emergency preparedness initiative. Dan Wilson, as Michelle said, was the leader of that group. Well, we don't have that same initiative this time going around, but one of the things that the GMR office wanted to do was to strengthen the National Network Emergency Preparedness and Response Plan within our region. So in order to avoid or limit as much the interruption and access to information throughout the region and nationally during those emergencies and disasters. We also wanted to engage more of our network members actively and effectively in participating in NLM programs. And so with that, we created a number of advisory groups. And if you scroll down to the bottom of that page, you can see that we have a working group called Disaster Health Information Coordinators. This is a new initiative. We have 1 member from every state, except we're still working on South Dakota in our 10-state region here in the GMR, who has volunteered to become one of our Disaster Health Information Coordinators. And we're really not even sure yet at this point if that's what we're going to call our group, because we're still in formation right now. And actually, we are using today's webinar as being a springboard for the work that we're going to do together. One of the advantages of becoming a Disaster Health Information Coordinator within the GMR is that the GMR is going to fund the registration process for becoming a disaster health information specialist through MLA. So that's one of the perks of this, not only for the individuals, but for all of us in the region, because we will have specialists on hand locally and increase the capacity within our region for emergency preparedness. Would you like to go to the next page, Siobhan?
Yes.
Thank you. One of the other funding mechanisms that we have put together for emergency preparedness in the GMR is an Emergency Preparedness Award. And this award is actually following the New Jersey initiative that developed after Hurricane Sandy. Just as the National Network Emergency Preparedness Initiative in the previous contracts with NLM were based basically on as a response to what happened in Katrina. In any event, this Emergency Preparedness Award is one of our funding mechanisms that fits in basically with what we have designed to be the aims of our cooperative agreement with the National Library of Medicine. So basically, this is a way that we really want to get our network members engaged, involved, and strengthened in the emergency preparedness and response plan. So part of our objectives with this are to train public library staff. We also want to increase the role of public libraries, but we're also considering engaging state organizations. So it's not just public library group, but it's also various groups within the states who may be a consortium and who want to take a stab at this and seeing if they can get their communities at a place at the table in emergency preparedness. We don't have any takers yet. Eligibility is just 2 members in the GMR, our 10-state region, and we're hoping to have the funding actually fund 3 initiatives up to $10,000 through this initial year of the grant that we have with the National Library of Medicine. We're hoping that this funding mechanism on the website is very straightforward, and if anybody has any questions within our region about that or elsewhere, I'd be very happy to talk with them about that. We may not get this on, off the ground, this funding at least off the ground this grant year, but we definitely will have our emergency preparedness coordinators up and running and become disaster information specialists. Thank you.
All right, well, thank you, Jacqueline, and thank you, Michelle, as well. So, so each of the regions, each of the 8 regions is working in some form or other on disaster health information. We didn't have enough time to have everybody come on and talk about it, but I would really advise people who are interested in reaching out. Membership is for not just librarians, but people who work in health information to reach out to your regional medical library and become a member. It's free, and learn about some of these disaster health initiatives as well as other initiatives that the regional medical libraries work on.
So Siobhan, if I am a emergency manager or public health specialist in my local health department, can I contact the national, the regional library of the national network?
Absolutely, you can contact them, and your organization can become a member. And becoming a member provides you access to many of the benefits that some of these that Jacqueline and Michelle were outlining in their talk today. So yes, the membership, and even if you're not a member, of course, contact them for help and assistance. And one of the great things is the regional medical libraries are in close contact with medical and public libraries in their states, and so they can connect you with even more local persons. So what, we always say disasters are local. So through this kind of chain where we start with NLM kind of at the national level and the regional medical libraries at a regional level, then they can connect you to your local library, and that's what we need with disaster response. I know that we started off everyone muted. Can you check and make sure your phone is muted? There's a little bit of feedback on the call, and we're not sure where it's coming from. Are there any other questions?
If, we'll keep the line open here for a little while, and if you have any questions, please feel free to put some of those in there, and also our contact information. You can reach any of us at DIMRC, D-I-M-R-C, at nlm.nih.gov. And we'll put that in the chat box as well. And while I'm giving people a chance to see if there's any other questions or if anybody has a comment they want to make, please do put that in there and we'll take a look. I just have 2 small announcements. One, our next meeting, it's scheduled for February 9th, but we've been going more from a monthly schedule to an every other month schedule. So it's possible we will not have another one until March 9th. So if you are on our listserv or on one of our email distribution lists, watch for the announcement for the next webinar. And also remember, you can come back to our website, what's showing on the slide actually here, where it says the recordings and slides will be added online. You can view this webinar on there in about a week or so, and all our previous ones going back, I believe, to 2009 or 8 or 9. And remember, you can get CE credits for those from the Medical Library Association. You get 1 credit hour for each of these, even if you're listening to the recording. All right, so the last announcement I want to make is a big transition for us. One of the founders of the Disaster Information Management Research Center retired it was December 1st. It was somewhere in there, and that was Cindy Love. And I think many of the people who are involved in the National Network of Libraries of Medicine, in any of the medical libraries, and also even in the preparedness sector and response sector. May have known Cindy. She was one of the very first people getting involved in this here at the National. Okay. We have somebody's phone is on hold, I think, and we're listening to some music. We're going to look for that and see if we, okay, it stopped. Anyway, this is just a little tribute to Cindy, and, you know, we miss her, and we're hoping she'll still be able to do some work with us in the future, but she's just enjoying her time off right now, and after 30 years, I believe it was, at the National Library of Medicine, I think she deserves a break. But if it, you know, wasn't for Cindy and our branch chief, Stacy Arneson, none of us would really be here, and this information wouldn't exist and be easy to find. And so we owe it to them, and Cindy gets her well-deserved break, but we do miss her. So if there's no other,
there are a couple
more questions?
Yeah,
okay.
There's one. How long is this certification good for?
Oh, I think it's for 3 years.
3 years.
Okay, yeah, that might be on the page that we put up there for the Medical Library Association, Disaster Information Specialization, but we think it's 3 years, as Siobhan just said.
And then another question is, where do you see disaster information trained librarians fitting in with the Medical Reserve Corps?
So that's a great one. So one of our courses is, of course, the information roles, but you can become a member of the Medical Reserve Corps. And Stacy, are you a member of the Medical Reserve?
No, I'm not a member of MRC. I'm a member of CERT, the Community Emergency Response Team. We don't have an MRC in our area right
Okay.
now.
I think Dan Wilson is a member of the MRC. You know, there's so many different things, so many information needs that everyone needs in disaster response. So, for example, one of the roles that really fits perfectly what librarians do is situational awareness, and being out there on social media and finding what's going on in an area. So if you're in part of the Medical Reserve Corps and maybe you're following social media and you see that a road is closed, or you see that there's people who need assistance from the Medical Reserve Corps in a certain area. Things like that, that situational awareness of pulling together the information and organizing it and presenting it to the Medical Reserve Corps responder disaster workforce in a way that they can use it and make decisions on how to respond. That's just one small example of how a person with an information specialization can use their skill set to assist in organizations like the Medical Reserve Corps, and there are librarians who are members of Reserve Corps. The Reserve Corps has all kinds of people who are members, not just the healthcare professionals.
Right, because all organizations need information and need information professionals, and another way is to help them know ahead of time about the various information resources that are out there. So if they are called into something, some of the Medical Reserve Corps, you know, do the emergency response, but sometimes they do a little bit more day-to-day activities. It could be vaccines or other kinds of things, but making sure that they know where to get that information and have it. Another area, for example, would be our Packing Your Digital Go bag, and we have a page of disaster apps that many in the disaster workforce, we recommend that they put on their phones and tablets, other mobile devices ahead of time and learn how to use them, and that's another role where librarians could help them get familiar with these tools and resources and how to use them and when and where they can be used. For example, do you need connectivity for them, or can they stand alone? Is the information residing right on the device? So those are a couple of ways that you can assist with your Medical Reserve Corps. And I do believe there are a couple of librarians who are members of disaster medical assistance teams, DMAT teams, that are actually run out of the Department of Health and Human Services, in which case if you are activated under DMAT, you become a temporary federal employee during that time. And there are a couple of librarians that assist in those programs as well. And I was corrected that in my area there is an MRC. I believe it's relatively new. So I apologize to anybody in this area on MRC.
All right, we do have another question on here, and it says, from Patricia, that says, what would you advise for me to do in my first step? Complete the basic course and then the advanced.
I would say definitely start with take the basics course itself. So that is not just the basic specialization, but just go ahead and take the basic course, because that will give you a really nice background. And one of the things is learning the language of response in disasters. So taking that basics course gives you that, and then we'll give you some information on what are the things that out of that class that you really liked. So from there, you might decide you want to take the other courses to get your basics specialization, or you may say, wow, I'm more excited about some of these other courses down here.
Yeah, one of the other classes that we did mention is the information roles in disaster management. I would also recommend that as another good class to take initially. It's listed in the basics section. That will help you decide what kinds of roles you might be able to play, and it might steer your interests in some of the other classes.
That's a good point too, yeah. And here's the topics that are covered in that class.
So we're always looking to hear from people about what kinds of things that they have done with their communities in this subject area. So if you have any stories or anecdotes or things that training courses you've done or other kinds of things that you've participated in, we'd be happy to hear about that and keep people posted and let other people know what kinds of roles they can play, because it's an expanding field.
Yeah, and if anybody is interested in some of the ideas about how you can interact with your community with disaster health information, I have two other suggestions. Not only take these classes, but also we have a bibliography, a rather extensive bibliography of articles and stories of how libraries and librarians and information professionals have worked in disasters, not just in their own libraries, but in their communities as well. So we're showing that page now, and we can put that link into the chat box. And I'll give Jen just a minute maybe to do that. And then the other way, well,
it's down at the bottom. If you go to the if you go to the Disaster Information Specialist page, it's right.
Yeah, there's a link to the bibliography page there. All right, and also for 5 years, and this is the first year we did not do it, but for 5 years we funded with small contracts, I believe it was 20-something or 25 different projects where libraries or librarians or other information centers partnered with a community organization that had some disaster responsibilities, and they did projects where they would work together, and in some cases they developed apps. They worked together to do that. In other cases they developed web pages, or they developed training classes, or they created a role on their emergency response teams, and a whole host of things. And we have a link to those link to that page where you can read about what some of these librarians and these organizations did to work together. So you might get some ideas there about what can you do with this disaster health information specialist role. And that link is coming up there right now. All right. And we'll put that in the chat box. That's the page. So we are coming to the end of our time here today. We appreciate everybody's attention and their interest in this topic. And we're, again, if you are not on our listserv or not on our email distribution list, you can do one of two things. You can go to our home page and look for the section on the left-hand side that says Stay Connected, and you can also email us directly at nlm.nih.gov, and we will get back to you about how to stay connected with us. So if there's not any other major questions here or any other comments, I think we'll see if there's anything here. Okay. All right. Just a few comments that we'll take a look at. Nothing else? All right. Well, everybody have a nice afternoon or end of morning, depending on where you are. And we'll let you know when our next webinar will be.
And thanks again, Michelle and Jacqueline, for your great presentations.
All right. Well, we're going to log off now. Thank you very much. Bye-bye.